Hey everybody, welcome to Doc Simple. I'm Doc Ben.
And I'm Doc Leo.
And today's episode is otitis media or ear infection. All right, today's episode, otitis media or ear infection. First section, symptoms.
All right. So some symptoms of ear infection are things that you'd think of. So you have some ear pain, you may have some fever, you may have some muffled hearing, you may have some sore throat because ear infections can be associated with viral infections. You may have some drip in the back of your throat that's causing some irritation.
Now, Leo, that's for the majority of people out there, especially those who can speak. What about the young ones who aren't yet verbal and some of the other symptoms that little kids could experience?
I see. They get ear infections?
Yes, they do. Quite often. Mm-hmm.
Okay. So for that population, it is a bit more challenging. When they can't communicate with us, it tends to be nonverbal signs, and that tends to be pulling at the ears, a lot of fussiness and irritability of the child. Parents would note that these aren't usually subtle symptoms, as they usually wake them up at 3 a.m. screaming and crying, and the parent does not know why. So if your child has some of this, including sometimes even abdominal pain, your child may have
abdominal pain.
Yeah.
Mate.
Right. Yeah. It's a referred symptom that's associated with ear infections.
Okay, I'll trust you.
All right. Thank you.
Trust us.
In those scenarios, you may need to get some medicine for the child.
Okay. Well, speaking of that, what are the treatments of otitis media?
Under treatments, we primarily focus on things like acetaminophen and ibuprofen or over-the-counter medications. And we would urge parents as well as adults to try that as the initial therapy because the need for antibiotics, while may be necessary, is not necessarily urgent, would you say?
That's right. I would absolutely say. Antibiotics might be indicated, but delay and start is totally fine. A day, maybe even 2 days.
Yeah. In fact, sometimes when we tend to see people in the emergency room, if their symptoms are broad enough and the ear itself doesn't look that bad, we'll do something called watchful waiting, where we will maybe provide a prescription, but hold off for a bit before starting the antibiotics. And we'll ask the parents to maybe wait 24 or 48 hours before starting because we think it's more likely viral. And the ear just happens to be one of the symptoms the child's experiencing, but not the primary focus of the infection.
Right. Expectations and prognosis. How long should we expect the symptoms to last?
Forever, it feels like, right?
Oh, yeah. Forever, it feels like.
Yeah. But in reality, probably around several days to...
maybe a week.
To a week, yeah.
Okay. Let's do the next section. Who to call, where to go.
All right. So there's the population of adults and kids that basically can't be hydrated. Because they're vomiting or their fever is not well controlled. And in that circumstance, you're going to need some professional help. You need some antibiotics, and you may need some hydration through perhaps an IV.
Right. The overwhelming majority of people, though, can manage a lot of this at home, maybe with the help of a prescription for antibiotics. Yeah. That's it. This episode has been on otitis media or ear infection. I'm Doc Ben.
And I'm Doc Leo.
Thanks for listening to Doc Simple.
Please like us and share us.